Hi knowledge nuggets. Today our video is on the basics of pharmacology, that is understanding the receptors, substrates and the drug interactions. So, have you ever wondered how medication works in our body? Well, it all comes down to the receptors and the substrates, right? See, what are receptors and substrates? Let's see. The chemical substances like hormones, neurotransmitters or drugs acts as an substrates. These substrates bind to your receptors on the cell, triggering a response. This can lead to things like muscle movement, enzyme activation or hormone secretion, right? The substrates can be endogenous, that means produced naturally by the body, like serotonin, a neurotransmitter that regulates the mood. And the second example is insulin, a hormone that controls the blood sugar. When coming to the exogenous substrates, these are introduced from outside, like medications. Example, ibuprofen, which reduces the pain and inflammation by blocking the certain responses. And once the substrate bind to the receptor, it forms a substrate receptor complex, leading to a biological effect. So now let's see what is agonists and the antagonists. The substrates that bind to the receptors can be either agonist or antagonist. Agonist activates the receptor, triggering a response. For example, if you see albuterol, that's an beta-2 agonist, bind to the lung receptors and helps relax the airway muscles, making breathier easy. That helps in the asthma. And coming to the antagonist, antagonists block the receptors, preventing the activation. For example, beta blockers, let's say it's like a metoprolol. These block the epinephrine from binding to the heart receptor, slowing down the heart rate and lowering the blood pressure. Some agonists compete to the same binding site as the natural substances. This is called competitive inhibition, while others bind elsewhere and change the receptor shape, where we call this as a non-competitive inhibition. The common drug targets and the applications are many drugs target specific receptors to treat the different conditions. Isoproterenol, that stimulates both beta-1 and beta-2 receptors, increasing the heart rate while also relaxing the airways. And coming to the next example is the clonidine, an alpha-2 agonist, reduce the nerve signals, leading to the lower blood pressure. Understanding these interactions helps explain how medications treats asthma, blood pressure and heart conditions. Stay healthy, stay cheesy with Pharmacy Made Easy. Follow for more.